Thank you for inviting me to take part in your Young Onset Dementia Summit. I'm Tessa Gutteridge, Chair of the Young Dementia Network, and I'm Dementia UK's Programme Director for Young Onset Dementia. I'm going to tell you about the UK Young Dementia Network. Ours is a particular model, born of circumstances at the time, which has evolved and is evolving. It's pragmatic, collaborative, and it depends on volunteered expertise, and there are pros and cons to the model. I'll share what's been important to us in case it's important to you. Straight to the purpose of the network. To improve the lives of people with young onset dementia and their families now and bring about significant changes that will have lasting benefit for the future. As you know, young onset dementia affects every aspect of life. But to make a difference, we have to focus on just a few that are priorities for the members. So specifically for us, we aim to improve the experience of diagnosis. We aim to increase access to lifelong support and ensure a better understanding and awareness of young onset dementia amongst the public and professionals. So what is the UK network? Well, it's an online influencing community primarily. It's a collaboration, if you like, of like-minded people. It's the first and only national entity for young onset dementia. It has its own identity and brand and its own platform and communication channels, and I think that's really important. It's a focal point to drive systemic change in services and support nationally and locally. And as part of that, we have to raise the profile of young onset dementia and to share knowledge about young onset dementia too. It's also a focal point for individuals to send a message, you're not on your own. This is for younger people with dementia, family members and professionals too, who often feel isolated. There's a community that you can be part of, which understands young onset dementia and what's needed. So to the membership. We have over 5,600 members so far. We're ever growing, and particularly in the last 12 to 18 months. We have an informal membership, no subscriptions, no fees. We have a mix of passive and active members, and some are really core to the activities. Around 11% are people living with young onset dementia, 30% are family members, and over 50% are health and social care professionals and young onset dementia service providers, and the rest are academics, researchers, and other activists. So why set up the network? I was director of a small young onset dementia charity, ambitiously called Young Dementia UK, which in its early years established award-winning innovative support in one particular county. Looking beyond, we observed that services and support for the many people with young onset dementia and their families was inequitable, fragmented and patchy. And like you, we wanted to set up something that would make a difference to those people living with young onset dementia who had no voice. Could we develop the catalyst? The issues faced were repeated time and time again, issues which you will recognise. The experience for most younger people with dementia and their families did not enable them to live as fully as possible from pre-diagnosis to end of life. It took years to get an accurate diagnosis, and damage was done meantime. People were further disabled by the ignorance of those surrounding them. We identified national government and National Health Service, who set policy and guidance, were pretty silent on young onset dementia. Even though young onset was different, the impact was different and needed a different approach. We felt no single organisation could improve the situation and sustain that improvement, but perhaps a determined network of people and organisations could. We felt it was important to nurture and pool expertise, harness the passion and the energy, identify the evidence and the leverage we needed to improve the present and the future. So, back in 2015, we identified experts, including activists with personal experience, and personally invited them to participate. We felt it was very important to have senior academic researchers who had that depth of expertise in young onset dementia, because that's provided us with more robust evidence. We felt it was very important too to have a range of clinical roles for that day-to-day experience. And we had a senior representative from a dementia media and events organisation, and all the invited individuals needed to be well networked themselves. Charitable trust funding enabled us to launch within a year from our starting point. They were interested in young onset as an underserved community where there were challenges but with potential to live better. This funding enabled us to employ a dedicated staff member, and we set up comms and channels and created a brand. We didn't seek government funding. Our preference at the time was for the network to be independent of public funding. So how does it work? Well, the invited experts form the steering group. We asked for a sign up to a collaboration agreement. Steering group and working groups currently include major dementia organisations, many of whom have been our founder members. So the Alzheimer's Society, Alzheimer's Research UK, Dementia UK, Rare Dementia Support, and involvement networks for people with dementia, and we have contact with Family Member Involvement Network too. So the steering group strategize, prioritize and plan, and the working groups, and we have 3 of them, diagnosis and support, research and evidence, and understanding and awareness, and they're led by steering group members, and they make things happen. So on the left of this slide, there's myself, Catherine and Kate, and we're the 3 part-time paid staff, about the equivalent of 1.5 full-time staff members. But we, to be honest, punch way above our weight. Young Dementia UK merged with Dementia UK back in 2020. Young Dementia Network, established by Young Dementia UK, was considered an asset and transferred as part of that merger. Together we felt we could create a stronger, more powerful voice for people with young onset. The benefits, well, Dementia UK has an excellent reputation as provider of specialist dementia nurses. It's a growing charity, ambitious, well-funded and successful, and importantly for us, understands that young onset dementia is different. Dementia UK has the ear and respect of the National Health Service, especially through Hilda Hayo, Chief Exec and Chief Admiral Nurse, who is a young onset dementia specialist. Young Dementia Network gained credibility and profile through the relationship with Dementia UK. And we're about to begin planning our next 3 to 5 years, and we can do this with much more confidence, hosted by Dementia UK. We drew up a hosting agreement that preserves the autonomy of the Young Dementia Network. It doesn't remove all the challenges, but it does reduce them, and of course we align on values and ambitions. There are mutual benefits too. Dementia UK provide the support to people with dementia and their families, and Young Dementia Network doesn't offer direct support, so we can confidently signpost to Dementia UK. Excuse me. Dementia UK is now developing itself as a young onset dementia centre of expertise and the go-to charity for families. An example of this is the investment in the appointment of a consultant Admiral Nurse for young onset dementia and for children and young people. That's Jules Knight and Hannah Gardner, who are pictured here. Dementia UK is more recently developing its campaigning capacity. Hosting Young Dementia Network is an essential element to this ambition because we offer a ready-made influencing community, young onset dementia expertise and much else. And there are practical benefits too. We're currently working together on developing a young onset dementia pathway from pre-diagnosis through to end of life to introduce to all areas of England initially and then other UK nations. And together we've compiled a professionals contact list and have created a National Health Service map for young onset dementia. This is a unique compilation. So to impact. For the past 3 years, you may have noticed have been a very unsettled period in terms of politics, health and social care, economics, and society itself. But throughout, we've adapted, we've taken opportunities where possible, and we've kept going. So what have we achieved? Well, increasing awareness nationally of young onset dementia. The network has definitely contributed to this and continues to do so. The network is a conduit for messaging, such as why we prefer to use young onset instead of early onset to avoid the confusion with early stage. And we highlight the impact on children and finances and work and such like. So we highlight the difference. We provide many avenues for those with personal experience to tell it how it is. We had a recent call out for exactly this earlier in the year, and over 200 individuals responded with their personal stories. We wanted to raise awareness of young onset dementia in non-specialist professionals for when their paths cross, families affected. This is pretty slow, but there has been some progress. So in terms of improving understanding of young onset dementia, we very much wanted to do that. The key reasons people join the network are to help improve young onset services, improve their understanding of young onset dementia, and receive information. We have various tools to improve understanding, and feedback indicates that we've hit the mark. Through the Young Dementia Network site, which you're welcome to have a look at, we give access to research and evidence, webinars for professionals, information about young onset dementia, and resources that we've developed to improve understanding. So homing in on that webinar program, well, this is easy access to young onset expertise. It's through a regular young onset dementia webinar program with over 3,300 registrants for the recent 10 webinars and 2,000 attending, and many more people use the recordings and catch up on the recordings. Feedback and satisfaction for these webinars is absolutely excellent, and I know we've welcomed some Australian attendees to these. And then the resources, thousands have been downloaded and mailed out. In truth, we don't know to what extent they're used, but when we do get feedback, it's good, but it's not thorough. We need to improve on that. We have created resources for individual and family members, ID cards, for example, for primary care, for clinicians and local service development and commissioning. We also send out regular newsletters to keep members informed, keep that community connection. And then in terms of involvement, it's really important, isn't it? Because people want to use their experience to improve the future for others. They want something worthwhile to do, something that they value. So we've opened up many more opportunities for younger people and family members to be involved in research, present at conferences and webinars, contribute to national and local consultations, and shape what the Young Dementia Network plans, shape its resources and its activities and such like. And similar for professionals, we've opened up opportunities of similar types to professionals, but obviously a different perspective is offered there. And then in terms of policy and public affairs, Young Dementia Network has contributed to and featured in national strategy, policy and guideline consultations. We'll put a young onset perspective where there may be none. So we'll ask the question, what about young onset? Here's how it's different. Here's what needs to be done to work for young onset, and we want it to be explicitly including young onset. Recently, we accelerated our campaigning work. We initiated a project to improve the experience of diagnosis for people with young onset dementia and their families. We shared this project with the Dementia UK policy campaigns and public affairs team, who took on the leadership of the parliamentary work. And they've made some headway with that, with young onset appearing via MPs' questions and such like. And together we're encouraging the implementation of a young onset dementia pathway in every area of England, which would also include a lead young onset clinician in memory services, a commissioner responsible for young onset dementia, and a young onset dementia expert by experience forum, and a key worker, similar I think to the young onset navigator that you've proposed. We need NHS, National Health Service, to require this of the local areas. And then we had to improve research and evidence. Accurate data on young onset dementia has been difficult to find, and that's, I think, similar to your own experience. Without that, it's a real challenge, isn't it, to put a case for improvements. We've been instrumental in estimating more accurately the prevalence figures for the UK and for each nation within the UK and then locally too. And Young Dementia Network with Dementia UK and others has worked to encourage all key organisations to use the updated figure, over 70,000 people. So next we're working on a proposal to improve coding of young onset dementia so that understanding the diagnosis numbers is more accurate and so that individuals themselves have an accurate diagnosis. We're heading in the right direction on that. And then there are 3 prominent academic researchers, all network steering group members, who successfully undertook the largest ever UK young onset dementia study called the Angela Project. There are lots of publications that are available to you, provided much needed evidence on both the current situation for people with young onset, but also what works well for people with young onset, which we continue to use to support our case for change. We keep in touch with the Dutch Young Onset Dementia Knowledge Centre too, collaborate on international dementia research programmes with them and on webinars. So what do members say about us? Well, we still have a long way to go and we have lots to do. We have not got it all right by any means, but we are heading in the right direction. We've been able to accelerate our activity in recent years. Whatever your networks looks like, you'll want the endorsement of people living with young onset dementia and family members. So I wanted to share a couple of ours. The sense of connection between service providers, people with young onset, and researchers provides a powerful vision of putting together knowledge and influence. Could not have said it better myself. And then the network gives me a voice. Instead of a voice in the wilderness, I'm now part of a choir singing in unison. It gives me comradeship and the support of others on the same journey. The network has got my back. Finally, a few parting thoughts from me to you. Keep people with young onset and their families at the heart of what you do. It's easy to let services and organisation agendas take over. Be ambitious, realistic and determined and don't let up. Have a distinct young onset dementia identity and branding, even if you're hosted. Including in that identity a distinct site, I think, communication and social media channels. The network needs its own mouthpiece. Let it develop its own voice and keep the focus firmly on young onset at all times and don't dilute it. For this reason, some dedicated staff would be valuable. Most of the people on the steering and working groups, to my mind, need to be genuine champions who have expertise, passion, time and determination. They need to be senior, and it's not enough just to represent an organisation because it's your role. You need to mean it and you need to feel it. Put aside organisational and professional egos. Commit to working collaboratively. Achieve more together by that means, and agree a collaboration code which shares the kudos. Commit for the long haul and throughout find ways to keep yourselves motivated, energised and positive. Establishing and sustaining a young onset service nationally is a challenge. So include those short and medium-term achievements so that you can keep control over them, but also so that it keeps your spirits up. Make sure that people enjoy being part of it. Keep the blend of personal and professional expertise. Keep positive, identify solutions to the issues and offer multiple ways to be involved. And then keep growing, especially look for ways to grow expertise across a range of professionals. Keep enabling new voices and strengthening existing voices, and keep looking ahead for opportunities to embed improvements. We wish you every success with shaping the future for young onset dementia. It must be done.